Good evening, everyone. I'd like to welcome you all tonight to The Modern Addiction, Painkillers and Heroin. My name is Denise Mananis. I am the Director of Marketing and Public Relations for St. John's Riverside Hospital. And I'd like to introduce our speakers tonight. We have next to me Dr. Edna Pierre-Louis, who is the Chief of Service for Addiction Medicine for the Behavioral Health Services Department at St. John's. And next to him is John Slotwinski, who is our Director of Clinical Services, also for Behavioral Health Services at St. John's. And I'd like to thank you both for being here tonight. So I'd like to begin, gentlemen, by first defining what heroin, opioids, and painkillers are and how they're related.
Okay. Opioids are a group of drugs of which there are many. Morphine, codeine, oxycodone, hydromorphone, and so on and so forth. They are part of a group that are called opioid painkillers. They act basically in the brain to kill the pain, basically. That's what they do. We deal with two kinds of pain. One is basically what we call a mechanical pain, which is if you get hit, you get into a car accident, or you fall down, they'll take care of the pain quickly. We also have another type of pain that is mostly a nerve pain. Might be caused by a pinched nerve, herniated disc. These will take care of the pain also, but they are not the best medication for this kind of a pain. So opioids include all these medications: heroin, morphine, codeine, oxycodone, hydrocodone, all of them. They are all painkillers.
Okay. And heroin then is the straight version or the pure version of that?
That is, yes. Go ahead.
Pure, that's the daddy of all the opiates. Unfortunately, with the opiates, they not only decrease the body's sensitivity or perception of pain, but they also interact with the reward pleasure system, the mesolimbic dopamine system. In a sense, they hijack that system. Actually, some researchers have even referred to it as a hijacking of that system. That is, they give the jolt creating incredible euphoria and pleasure that really can't be duplicated by the natural stimulators, the dopamine stimulators, like as from food, the things that we need for the species to survive: food, sex, social interactions. And so in a sense, it really distorts that particular system, which is really the anatomy of the addictive process in the brain disease.
Okay, so why then, and I think you started to answer this, but why are opioid painkillers so dangerous? And how, there's been a lot of press about it lately, but how have they changed the face of addiction in the current environment?
Well, you have to be careful in saying so dangerous because there is a place for them. Okay? For instance, if you are in severe pain, if you have an MI, a heart attack, okay, the first thing that they have to give you is something to take care of the pain, because the pain causes stress. Stress causes stress hormones, and they make your heart attack worse. They give you morphine, stop that, some oxygen, nitro, and boom. Okay, so there is a role for opioid-based painkillers. They are better used in the acute phase, if you have acute pain. And actually, part of the place where they were used quite a lot is in war. During the Vietnam War, morphine sulfate, all the troops had, and still do, morphine sulfate. They have to take care of the pain because it causes too much of the stress hormone to be delivered and cause more problem. So that's the normal use and the good use of opiates. At the same time, I think John touched on the fact that once you use opiate, it also causes quote-unquote pleasure or euphoria. And that's what, in the long run, might cause an addiction to someone who is predisposed. Not everybody who takes opiate get addicted. Only a very finite population get addicted.
So is it the difference between using it for an acute problem versus a chronic problem? And is that the difference in how people become addicted?
That is correct, partly correct. In fact, the use of opiates for chronic pain didn't really start until the late 80s and the early 1990s. We usually left it for the acute pain and everybody who had terminal illnesses, terminal cancers. This is the only place where they were being used. The medical profession was criticized for not alleviating pain enough. So back in the 1990s, there were articles that came out telling people how to use it safely. And unfortunately, once you start using it safely, it becomes also used unsafely. So I don't know if you have anything to add.
The pendulum swang very far to one side, where there were enormous number of scripts written for chronic pain, but every kind of everyday pain, back pain, the things that actually probably could be treated, at least from everything I've read, could be and perhaps should be treated with other medications, and more effectively treated with other medications. At this point, the market or the field got saturated with multiple types of semi-synthetic opiates that we're talking
Such as what? That people would recognize?
Oxycodone, Oxycontin, Vicodin,
yeah,
stuff like that.
Percocet.
Percocet, obviously.
That's a
Tylenol number 3, but that's a little bit older, but still used, yeah.
It is, yeah.
And actually, there is a very good story about Oxycontin. When they came out, actually, the pharmacy people were not too far from here. The name of the company, I believe, is Purdue Frederick, if I'm not mistaken. And they were the one who started with it. And they went to the FDA and said that the addictive properties is not greater than others, but it's much more effective for a pain. It so happened that it's also more, just as addictive and maybe a little bit more. And that started everything going. It was basically around 94, 95 that they started.
All right, so painkillers then that are being prescribed for chronic pain, would you consider that a gateway drug? Would you consider them?
No.
I do.
No, not less. Right.
Tell me why.
Not that it's naturally a gateway drug, but it's become that. If you look at studies that are recently done by, I think SAMHSA, NIH, they found that of the new needle users, young heroin needle users, 50% and more, some studies show up to 80% started with synthetic or semi-synthetic opiates at this point. So that is, I'm not saying that, well, I'm saying that that is a trend, and it's been a growing trend, unfortunately. And the transition over from pills to heroin is, once they get addicted to pills, and the pills, as far as I'm concerned, there should be a pill and it should be equal sign heroin, because it has the same effect on the body. In fact, when someone gets very addicted, they need the same kind of treatment, actually, as heroin. The problem is pills are extremely expensive on the street. Some people may be using 10 to 15 pills a day and buying them at $10 a piece, where someone today told me, actually, I met with one of my patients today to talk about this, and she said, I was using 10, 15, I don't know if it was Percocets, I don't remember, and she says, I bought one $10 bag of heroin, and it did the same thing, and better. So that's, at that point, in fact, she's in your methadone program as well at this point. And so, and I asked her also, I said, of the people, this is somebody who is from the upper part of the county, I said, she said, well, all my friends, we did this with all my friends. And I said, well, how many of your friends actually went the same route? She said, she looked at me, she goes, all of them. We all started using pills, and now they all went to heroin, every one. I think it's a trend that's growing. The statistics support it very clearly. So
Do you have statistics nationally, New York, Westchester?
Well, this is SAMHSA reports that 2014, there were 2,486,000 people were treated for opioid use disorder. Approximately 586,000 were for heroin use. 1.9 million were for prescription opioid painkillers. Okay.
So some of those people who are using the painkillers did not make the conversion to
Did
heroin?
not make the conversion, that's right.
Okay, but it's
Some
the
did
same
not.
addiction?
From my perspective, and clinically, watching it, treating this for years now, again, treating it in the clinic we have here, along with the methadone clinic and inpatient detox, because we're a continuum of care with multiple therapies, which is what's needed to treat this very difficult to treat illness. Same thing. Same thing. They wind up in the same place.
Right.
And we have people, this was a young lady who was a college student who could not finish college because of opioid painkillers. We have a young man who was on a police force, I'm not going to tell you which police force it was, but who had a good career and with opioid painkillers moved right to heroin. So that's why I say for me it's a gateway drug. I agree perfectly with Dr. Pierre-Louis. There's truly a place for opioid painkillers. There really is, especially for acute
Surgical,
pain, end-of-life treatment,
end-of-life,
cancer treatment for relief of pain. There really is. But certainly, I think what's being recognized now by the CDC especially, they recently, I have a copy of the article actually, have put out a notice for physicians that, to urge them to be careful with this. In fact, the director used some very strong language in terms of warning physicians about the overuse of these medications.
So are you seeing a change then in the clientele of people who are looking for treatment because it's beginning in a different way than it would normally for other patients of behavioral health services?
Yeah, obviously, because if you have someone who gets a prescription from a doctor, so they tend to go to doctors, they tend to have coverage. So you see a different population. And this is what he was talking about, having officers and people who were in school and so on and so forth. I want to go back a little bit about the gateway drug concept. Unfortunately, that started with Dr. Califano. Well, he's not a doctor, he's a lawyer, I'm sorry. Mm-hmm. Califano used to be the Secretary of Health and Human Services under Carter. That's how old I am. So now,
That's what you don't look
exactly. So now, when he left, he became head of the Centers for Substance Abuse and something else at Columbia University. So obviously, they were seeing a lot of the addicted patients had used cannabis. So they start, and also they smoked early in their teen. They were smoking in their teen, and they were drinking mom and dad's alcohol. So now they say, this is a gateway drug, the cannabis and the alcohol and so on and so forth. But guess what? There are a lot of kids who do this, and they don't become addicted. Therefore, the point that was missed is that the right environment within that individual must exist to become addicted. Okay, the person, if I were to give a drink to everybody here, okay, most of us might take one drink and that's it. And the other guy will probably go around and try to get another drink, another drink,
So
another drink until he's finished.
Internal environment?
There is an internal environment. There is a predisposition to addiction. As a matter of fact, if you talk to Dr. Chapuro, he will tell you it is a dopamine disease. And he goes around telling everybody that it's already there in the books. But I don't want to basically simplify it. There is a lot of causes. I'll give you another example. Alcohol is legal in this country. The last study I saw at one point, there are about 110 million people who drink alcohol. Between 10 to 20 million may use it somewhat recklessly. But there are, the last count that I saw was 3 million alcoholics. Now, if you have more than 100 million people who use alcohol and 3 million alcoholics, it tells you that this small group feel in a certain way when they use alcohol. They feel different than the rest of us. And so this is why I don't like to use the word gateway, because of the fact that you can see that most of those who have a predisposition start early. Okay, listen, I'm a father of 3 boys. You know, we know that they go to places and you hear from the other friends, this one drank, that one drank, but that one didn't drink, this one didn't drink, that one. It happens all the time. It happens all the time. So we have to understand that there is a predisposition.
All right, can you talk a little bit about the sort of the clinical effects of heroin and opioids, and what someone who is using them sort of looks like, sounds like, feels like? What do you see?
Well, unfortunately for them, the first time they use it is the best time. Then after that, it's over, basically. That's correct. And that's why they keep on using it. The first time they use it, there is the euphoria, the feeling of basically calm, a feeling they will tell you they feel high, they feel good, nothing bothers them. Some of them may nod out, meaning they drowsy a little bit. There is also what we call a respiratory depression, where they may not breathe as normal as they used to. From a 16 breaths per minute, they may go down to about 10 or 12. That is dangerous, very dangerous. But otherwise, these are the main early symptoms. Now, obviously, if you look at the person himself, the pupils may become very small, pinpoint, obviously, and there are other things that can show us during the usage.
So tell me a little bit about those. So if someone were, you know, I have 2 teenagers. So if I'm watching for signs, what am I looking for?
Observe, just be aware.
Exactly.
Okay.
Do the right thing and then trust them.
You will find they will be somewhat disoriented. They'll be forgetful. There will, a strange. Some parents have reported actually to me, and this is understandable, that their children will be buying laxatives. They start to get, they're becoming constipated because it slows down the motility of the intestine, and change in behavior, distinct change in behavior, because it affects, as it's used more and more, it affects other parts of the brain as well, the decision making, judgment and decision making, and other behavioral cognitive functions as well. So if there's what I would say to a parent, if there's a distinct change in behavior, and you see that child functioning differently, doing poorly in school, where they may have been doing better, those are all the basic signs. The basic signs.
Have you seen, I mean, I think from my own point of view, as I said, I have 2 teenagers. Have you seen teenagers getting into heroin through painkillers, from injuries, what is happening out there? Because that's what I think people are beginning to focus on, and focusing on this topic for.
Absolutely. We have seen that, and it's all over. I don't know if any one of you has heard of the governor by the name of Lepage. Governor Lepage. He's the governor of Maine.
Yes.
Okay? Yeah, he's the governor of Maine. So, yes, these 3, but I don't mean it for that. I am not going to go there. Yeah, I'm not going to go there. But they have a huge problem in the small states. Maine, Vermont. As a matter of fact, the governor of Colorado spent the whole state of the state on that only.
Wow.
Many of the governors. So I like to say, from Portland, Maine to Portland, Oregon, it's the same thing, all throughout the whole country. And what you find is that obviously opioid prescription medication that start first. They are unable to find it after a while because the doctor says, no, you no longer have pain, and so on and so forth, and they move into the heroin side of it. Yes, and that's how it starts for many of them. Obviously, not everyone would move that way. because some of the children or the kids or the teenagers who may have had pain from sport injury, once the acute event is over with, they fine and they don't use it anymore. But yes, that's how it started.
And you also talked about before, to tie in the vulnerability. Adolescents in certain way may have more vulnerability, or they may have vulnerability that we're not aware of. If there's underlying psychiatric issues that have not actually become obvious at this point, they may find that using the opiates actually make them feel better. It also they'll become addicted more clearly. In fact, the research also shows that those who start early have a much greater chance of having long-term addiction than those who start later.
That's correct.
Also, adolescence, if the young people who are taking it, adolescence in itself can be a very tumultuous time. All of a sudden, we had many adolescents who in a clinic, and it's very clear that they were trying to medicate themselves through the stresses, the anxiety, the trials and tribulations of adolescent life, because it is stressful. And in fact, that stress is important because it helps to propel them to move forward. However, the opioids they're such a powerful drug, when it takes that stress away, and they get that jolt of euphoria, it could become a very addicting process. They're very addicting medication, substance that's used to facilitate social interaction, things that they may be anxious about, etc. So it's a very that is a vulnerable time. There are other vulnerabilities as well that make one, such as some of these adolescents may have genetic loading. There's speculation about intergenerational transmission of addiction, or whether that's learned behavior or something involving the brain, how the dopamine is processed or not processed.
So then the opioid drugs have an effect on the brain that other drugs don't?
Absolutely. Yes. They are different in the way that they cause the euphoria. And one thing that I want to mention, I think John touched on this a little bit. There is an issue of quote-unquote mental illness also involved with addiction. Now, I don't want to use the word mental illness to talk about the more severe form, but studies have been done and have shown that a number of those that use have personality or mood disorders, okay? And many of them feel much better after they have used any kind of drug or some of the drugs. Because don't forget, not everybody is addicted to the same type. Right. Others, some are addicted to opiates, cocaine, amphetamines, and so on. Opioids, alcohol, benzodiazepine. So there is all sorts of addictions. And some people will say, I'll never drink, but I'll use opiates. I'll never use opiates, but I'll drink. So there is some form of an acceptance within the, what I'll call the genetic makeup of someone that make that person more likely to be addicted to one drug as compared to another drug.
I'll say there's another vulnerability as well. This one, and I'm bringing this one up because there's a very strong over the years they've shown a very strong correlation between PTSD and substance use, especially in women, but also men. PTSD, now they're understanding it as a spectrum illness, that you can have varying degrees of penetration into functional life. However, the correlation, actually Samson did a study, a huge study years ago, showing the correlation between, in women, with the early young sexual abuse, being sexually abused or physically abused, and the development of substance abuse later on in life. So, I mean, these studies have to be questioned, but this it's actually been shown over and over again in different ways that there is a correlation between that. And there's also, there's speculation that, in fact, trauma makes changes in the brain, and that, in fact, now this, substance use may, in fact, interact with that on some level, but that's not clear yet.
Going back to the statistics for a second, do you have any statistics about what's happened locally in Westchester, over the last 10 years, how it's changed in our own community?
That's some.
We'll take some.
Well,
I should say counties north of New York City. I pulled this stuff preparing for today.
Yeah.
Okay. Counties north of New York City have experienced 222% increase in admissions to clinics for opioid use disorder from 2004 to 2014. That's a big, big jump.
That's a jump.
In Westchester, admissions to clinics and opioid use disorder increased by 54% from 2007 to 2013, and overdose deaths increased by 117% from 2010 to 2013.
Yeah.
So it really is making a huge
It
impact
has. It has.
in our local communities.
yeah, and I know that many of you may have heard of in next to Peekskill, Cortland Manor, and also right across the border into Putnam. There are quite a few deaths there a couple of years ago. Quite a few of the kids died there. Pennsylvania also had a rush of deaths, something like 8 or 12 within a very short period of time.
All right, so we talked a little bit about the clinical aspects and what the drugs are. What's the prevention? And then we'll talk about treatment after, but what's the prevention for this?
Don't ever start. That's
Don't
the
start.
prevention. I mean, look, yeah, exactly. It's difficult. Okay. Obviously, I think, and I know you have children, and I have. They started in our school many moons ago when my kids were in school. They started that in, I believe, middle school and high school. There was teaching about not only sex education, drug education, driving drunk and all this kind of stuff. My kids also participated in what they call the midnight run. Anybody here knows what midnight run is? Yeah. Yes. Those of you who have kids, they go around, they sit there, and people call, and they go and pick them up because they're drunk. They're coming out of a bar, so an adult goes and pick them up and take them home so they won't get any accidents. So this is how they start. And the school system, we were very, very pleased because they took action. And all the children got education on drug use, abuse, and how to help each other. And so that's one way to start with prevention.
What we found also talking to the young people in our clinic, and that we started with opioid painkillers, was that they didn't see that as the same as heroin. That's why I said that really needs to be driven home to them, that it is heroin. They would say, I'll never in a million years snort heroin or, God forbid, shoot heroin. Every one of them went to shooting heroin with a needle. Okay.
Yeah.
They didn't, and everyone said, I didn't see that as heroin when I first started using, Vicodins that they got from somebody or Percocets. That has to be driven home that is heroin. But I believe it has to be a multi-pronged approach. There has to be a lot of education in the schools. It has to be addressed clearly. Also, the other pieces with physicians. Now, it's a little controversial, but it's not so controversial for the CDC. The CDC,
Yeah.
he says they're actually saying it should not be prescribed for chronic pain at this point, or very careful in prescription. Okay. Thomas Frieden said, from the directory states, we know of no other medication routinely used for a non-fatal condition that kills patients so frequently. Wow. Okay, this is about synthetic opioids.
Actually, the CDC just released guidelines,
Yeah.
and it has 12 different things to it, telling people how to use it and when to use it and so on. Now, I have told the story many times that I do not prescribe to people just writing script for opioids for chronic pain. I can tell you a story, but there are many, many stories out there. I work with someone who used to be an alcoholic. And she developed a condition called chronic pancreatitis. She had pain all the time, okay? And she says, Doc, there is no way I'm going to go back drinking. And I know if I take any opiates meds, I will drink. So she had TEMS, you know what TEMS, T-E-M-S, transepidermal, whatever, muscle stimulation. So she used to carry that little thing around her and then stick her in all the time. That was the only way for her to really salvage this. She was on pancreatic enzymes to eat, and from time to time it will flare up. She would end up in the emergency room. But for the years that I worked with her and I've known her, she spent, it was about probably 10 or 12 years, she was very faithful to not using any opioid med, knowing fully that this will bring her back into alcohol. Because, yeah, so there are many people out there that are actually doing it without the opioid medication. Because there is a number of gadgets, should I call them, out there that can help. There are also non-steroidal medication, although they have their own side effects, but ibuprofen, naproxen, Tylenol happens to be very good, but people don't believe that. People don't realize that Percocet has Tylenol. They put Tylenol in that for a very good reason, to improve the pain-killing effect as well as the anti-inflammatory effect. Endocet has Tylenol. Many of these medications have acetaminophen, which is the ingredient in it. So, you know, there are many medications that you can use. Also, now, if you look at Shaq on TV, he likes to use icy hot. You know, he put icy hot on his shoulders. Now you have lidoderm patch. You know, she's laughing, but you now have lidoderm patch. There are a lot of things out there that one can do for these pains. Don't forget, also, very important, opioid does not treat chronic pain. Opioid does not treat your arthritis. It masks it. It takes care of the pain, but it does not resolve it. It does not reverse the issue. If you have an inflammation, you need an anti-inflammatory drug. From time to time, you may need a drug such as a form of a steroid that we call prednisone that can be very helpful. Okay, sometimes the athlete, they give them a little cortisone shot in the joints. They don't tell them, go take Vicodin. No, they don't, because it's not going to resolve the inflammation. That's what caused the pain. You want to decrease the inflammation.
All right, so but let's go back to the idea that preventing an addiction to these painkillers and to heroin is paramount. So we go to education in the schools. I know my daughters come home and they are sort of, oh yeah, we have an assembly today, and they, you know, oh yeah, they talk about this, and there's a, you know, an adolescent view that those people don't know what they're talking about, and I hear the stories of the kids in the school who are drinking, the parties, and all of that. So what can parents do? How should parents address their children? And it can't just be in the schools, because there's a, you know, sort of a passive resistance to the information they're getting there. What else is there? What resources are there to help prevent and to educate them so they don't go down that road? Because as you say, that first time, it's euphoria.
That's correct.
So how do you stop them from going there? Because that sounds good.
It is actually very good for those who have used it. That's what they claim. But
I think to keep an open line of communication is very, very important, to be able to discuss these issues. These issues shouldn't be taboo. Not to go into it calmly, not to judge, which is sometimes difficult when you're a parent and you see your child perhaps hanging with the wrong folks, the wrong people, or in dangerous situations. Also, I used to run an adolescent program. For years I ran an adolescent program. And I tell parents, this is what I came to. I said you have to form the boundaries for your children and tell them clearly, I love you so much that I'm going to endure you hating me. Okay? That's how much I love you, because it doesn't feel good being hated, okay, by your child. I can tell you that the parents who've done that, eventually the child says, thank you, almost every single time. Because what they're doing is they're not being, that's when the parent says, no, I don't want you to go to that particular party or to do that. I mean, that's not perhaps the liberal approach, but I'm a very liberal guy, but it's approach that does work. And you know
not
what?
necessarily in raising kids.
That's correct.
But don't forget also, we cannot be telling our children no to everything.
That's right.
Because they stop listening after a while.
Mm-hmm.
Okay, so you have to see, I remember my kids, when they had the winter ball or whatever they had there in the school, so there were people there and they sent us stuff. They said, if your child comes intoxicated, he will be arrested. And then you will go to the police station to pick him up. That's what they said. This is what they sent to everybody's home. Okay? That's what they said to everybody's home. Now, luckily for us, our children played sport. You can't play sport if you use and they find out that you use. That's it. You out. If you drank, you out for the whole year. And they cared more about this than anything else, so that somewhat helped. But you can see that the school also set boundaries. They told the parents that's what will happen. But every year there is always one or two that the parents had to pick them up because they decided they were going to do it anyway.
Well, there were always one or two kids who were going to push that boundary.
They were going to do it anyway. So again, a lot of education, speak to your kids. The thing about children also is what the parents do.